ค่ะสวัสดีค่ะทุกท่านนะคะก็มีความยินดีนะคะที่วันนี้ได้รับเกียรติมาร่วมงานนี้แล้วก็ได้พากูรูนะคะด้านสุขภาพของอินเดียนะคะมาบรรยายให้กับคนไทยเราได้ฟังนะคะการเลือกครั้งนี้นะคะก็เราก็ได้เลือกคนที่เก่งที่สุดนะคะในอินเดียเป็นสายโฮมิโอพาธีนะคะท่านเป็นอดีตที่ปรึกษารัฐมนตรีกระทรวงสาธารณสุขด้วยนะคะแล้วก็ได้รับรางวัลพัดมาสตรีซึ่งเป็นเหมือนคล้ายๆกับเครื่องราชอิสริยาภรณ์ที่ให้กับคนอินเดียที่ทำคุณงามความดีให้แก่ประเทศชาตินะคะค่ะเพื่อที่ไม่ให้เป็นการเสียเวลานะคะก็อยากจะให้ทางดร. มุเคช บัตรานะคะท่านเนี่ยได้เตรียมสไลด์ Presentation มาเป็นเวลา1สัปดาห์เลยนะคะแล้วก็พยายามค้นหาว่าคนไทยเนี่ยจะได้ประโยชน์อย่างไรกับโฮมิโอพาธีนะคะท่านทำการบ้านมาดีมากเลยนะคะ so I think I don't want to take much of your time. I told them that you have been doing lots of studies to prepare for this presentation, especially for Thai people to benefit from homeopathy. So I would like to give the floor to you. Please, sir.
Thank you very much, Nini. It's so wonderful to have all of you come out on a Sunday morning. Please give yourself a big hand. Thank you for coming out on Sunday morning. It's really wonderful. That shows that you're health conscious. And thank you for this opportunity to present homeopathy to the Thai people. I'd like to start my talk by dividing it into a few parts. The first part is a little bit about how homeopathy was founded, a little background of the principle of homeopathy, and then I want to take you to 4 basic segments of where directly homeopathy can help, especially Thai people. So the first one, of course, is AMRs, which is antimicrobial resistance, and the other one is allergies. Lots of Thai people suffer from allergies. And then, of course, NCDs, which is non-communicable disorders, and then mental health issues, and then finally some rare diseases. So this is really what I'm going to talk about today, and I hope that you all enjoy it and benefit from it. So homeopathy was founded by a German doctor who was an MD doctor from the University of Leipzig called Dr. Samuel Hahnemann. What was interesting was that even though he was a medical doctor, his son died of some problem. And he said, I'm a doctor and I can't treat my own son. So he gave up his practice. And he started translating books. He was a linguist. He knew many languages. So one of the books that he was translating said that, cinchona cures malaria, because it is effective. And he said there are so many things which are bitter, but they don't really cure malaria. So why is it that only cinchona, cures malaria? So he started taking it on himself. And when he took cinchona, homeopathic medicine China, nothing to do with the country China, when he took cinchona, he started getting fever-like symptoms with chill, like malaria. And he said, therefore, this is the beginning of a new science called homeopathy based on likes cure likes. So what causes in a healthy person cures in a sick person. That's the principle of homeopathy. The word homeopathy comes from the word homeo, meaning similar, like homosexual, homeopathy, the study of. So it's the study of similars versus allopathy, which is the study of opposites. So to give you an example, and a very crude example, is what happens when you cut an onion. When you cut an onion, your eyes start watering, your nose starts running, and you get like cold-like symptoms. So therefore, if a patient comes to you who has running of the nose, watering of the eyes, redness of the eyes, if you make medicine from the onion, a medicine, homeopathic medicine called allium cepa, prepared from the onion, in a potentized small doses, it will actually cure the cold. So then becomes a very useful medicine for allergic rhinitis. So this is just to give you a very, very basic, crude example of how homeopathy works. It's actually absolutely based on the theory of vaccination. We all know after COVID how important vaccination has been. And thank you. And it was the which was later on founded by Louis Pasteur. So homeopathy founded vaccination, the theory of vaccination, 76 years before it was actually founded. So that's going back to the little background on how homeopathy was born. Just a very quick thing on then and now. So, when homeopathy was founded in 1796, it was only in one country, Germany. Today, homeopathy is 176 countries, including Thailand, Great Britain, Mexico, United States, Brazil, and so many other countries. Of course, at that time, there was only one doctor. Today, there are 500,000 doctors legally practicing homeopathy, and most of them are from India. So India has 300,000 homeopathic doctors, which do a 5.5-year medical course to practice homeopathy legally. There were only 200 drugs at that time. Today, there are 12,000 basic drugs, and there are more than 400 pharmaceutical companies. The first homeopathic college was in America in 1848. Today, there are more than 300 homeopathic colleges worldwide. There was only one manufacturing house, which was just done by, in a crude way. And today, there are 400 international manufacturing houses. Earlier, there was just a general analysis, which was all manual. Today, you use computerization, you use artificial intelligence, we use machine learning, and we can now predict the use of permutations and combinations of over 98,000 medicines in one second. That's what technology can do for you. So what I want to say is that basically it's moved a long way from also studies being based on observation and experience into clinical research and double-blind trials all over the world. So today there's a clinical medical proving of every disease that we treat. Coming to homeopathy in Thailand, it was first introduced in 1851 by an American doctor called Dr. Dan Beach Bradley. The Association of Homeopathy in Thailand was registered in 1st June 2010. And on last count, there were 78 graduate homeopaths in Thailand. One of them is with us today. Thank you for being here, madam. I'll now come to the relevance of homeopathy in the modern world. This is the core of my talk today. I'll start with AMR. What is AMR? AMR is antimicrobial resistance. To give you exact figures, 700,000 deaths were caused in Southeast Asia and 88,000 drug-resistant infections in a year, with 38,000 people dying in Thailand every year. This is the impact of our using antibiotics indiscriminately. So why does this happen? This happens because of two reasons. Point number one is, when you go to a doctor, you pressurize the doctor to prescribe for you a quick cure, even though a lot of the diseases are viral-based and antibiotics are of no use in that, but you still pressurize the doctor because you want to go back to work quickly. And because of that, you get antibiotics which are not really required, and therefore when you really need them, then they don't work. Also today, a lot of people self-prescribe. So because of Dr. Google and University of WhatsApp, we have so many people who actually, reading up on their own and taking medicines on their own. And when that happens, this is when then you develop resistance to antibiotics. And when you actually need them in severe and serious cases, therefore they don't work. According to World Health Organization, antibiotic use was the highest among inpatients aged 65 years and older, 57%, followed by children, 55.9%, and newborns, 33%. Now, these two age groups, the kids and the old people, are the people who are immunocompromised. That means the immunity level is low. Now, these are the people who actually now need antibiotics to work for them in cases of emergencies. And unfortunately, it doesn't work in such people because they've taken indiscriminately antibiotics. 88% of the working age of Thailand's metropolitan area self-medicate over the counter. Can you imagine? And over 5 years, the inhospitable IMR resistance produced damages of 66.4 billion bahts, $2.1 billion to the country's exchequer. So can you imagine if through homeopathy, we were to deal with this, not take antibiotics indiscriminately? This is the amount of money that you would be saving for the Thai government and all the hospitals, and also saving lives when they actually need it. This is the very simple research on homeopathy. It was found that 50% to almost 100% in upper respiratory tract infections, homeopathy worked very well. Lots of the cases when antibiotics are taken, they're taken for URTIs or upper respiratory tract infections, and sometimes lower respiratory tract infections. So for both of these, homeopathy in the earlier stages works very well, and therefore you don't need to go to antibiotics. This is a case of one of our patients who had, severe chronic bronchitis and had breathing problems. And this actually turned up because she had taken antibiotics earlier, and therefore antibiotics did not work now any longer. And she started getting breathless. I'd just like to play the video link over here.
introduced myself in this clinic as a patient of hair falling. But slowly I was treated for my breathing asthmatic problem also, which was very chronic at that time. Breathing problem नहीं रही है, मेरा breathing problem तो almost clear हो गया है.
The second commonest disorder that I'd like to talk about today is allergies. Can you tell me, any of you over here, which is the commonest allergy in Thailand?
ใครแพ้บ้างคะแพ้อากาศ ขอโชว์แฮนด์หน่อยค่ะ
Which one? Anyone? Name it. Which one? Face, skin.
Asthma.
Yes, yeah. So the commonest allergy in Thailand is milk allergy. It is called lactose intolerance medically. So did you know that 84% of the population of Thailand are affected by lactose intolerance, according to the World Population Review? And the recent study showed that. And with this, what happens? You get bloating of the stomach, you get diarrhea, you get gas. Every time you take some milk product, you have to run to the toilet. I have treated a lot of patients who actually suffer from this, who then find it difficult to reach their offices on time. They're always late for meetings because they have to go to the toilet at least 2-3 times if they have a glass of milk in the morning. The treatment cost of managing cow's milk allergy is 64,383, that is 2,077 US dollars per treated patient. Now again, you can imagine the amount of saving that you can do if you actually start using homeopathy in this country. This is a research which showed homeopathic medicines which actually helped in building up immunity against cow milk allergy. This is a case of a patient. Let's have the video again.
कुछ साल पहले से मैं लैक्टोस इंटॉलरेंस से परेशान था. मैं दूध की कोई भी चीज़ खा नहीं पाता था. 4-5 साल पहले मैंने डॉक्टर बत्रा को अप्रोच किया और उन्होंने मेरी दवाई शुरू करी. आज की तारीख में मेरी ये बीमारी बिल्कुल ठीक हो गई है. मैं दूध भी ले सकता हूँ और मिल्क शेक, लस्सी, छाछ सब पी सकता हूँ. मैं इसके लिए उनको बहुत बहुत धन्यवाद देता हूँ.
So allergic rhinitis, as you mentioned, ma'am, has now grown from 37.9% to over 50% in Thailand in the last few years. So sneezing, nasal congestion, you know, when somebody sneezes, you say, bless you. But I think also think of homeopathy at that time. The indirect costs of not treating allergic rhinitis are 105 billion US dollars every year. That means every patient spends about over 1,000 to 2,000 US dollars to treat it. What is more important is that the work productivity that is lost is 82% of this cost. That means because you can't go to work on time, because you are on leave, because you have absenteeism from work, you're actually causing a lot of money loss to yourself and to the country. So research has shown how homeopathy helps in 87.6% of patients. And this is a case, again, we can see the video again, of a patient who had allergic rhinitis.
Allergic rhinitis from the last 7 years. Severe sneezing, headache, stomach problem as well at that time. I got to know about Dr. Batra's and their treatment, and I started taking medicine. I'm feeling very good after being treated. Thanks a lot to Dr. Batra.
The other allergy, problematic allergy is skin allergy, as you mentioned in the audience again. So this is called atopic dermatitis in common words. Do you know that 33.7% of adults in this area called Ubon Ratchathani, I don't know how to pronounce it correctly. Yeah, Ubon Ratchathani. It's 2.3% of the population. And contact dermatitis, almost 1%. So a lot of people suffer from this because you get itching rash, you get redness, swelling patches, and so on and so forth. The medical cost of just treating this is 27.8 billion US dollars. And the treatments cost 6%, the inpatient care 37%, outpatient care 12%, and the labs 5%. So again, I'm just trying to show you what is the amount of money that we are spending in Thailand on these kind of problems, which can be treated by some alternative system of medicine. And therefore, how much of money you can save. And this is again a research that has shown how homeopathy helps. Sorry about these pictures, but this is one of the cases, terrible case. But you can now see after homeopathy, within 4 months of treatment, how the patient has improved. So, it is estimated that NCDs, which is the next topic that I'm going to talk about, which is non-communicable disorders. Basically, they're all chronic disorders which are non-infectious, like high blood pressure, high cholesterol, and so on and so forth, arthritis. It costs the economy $1.6 trillion, Thai bahts, which is almost 9.7% of the GDP. Can you imagine? And an average patient spends about 2,000 baht every month on the treatment of these problems. So things like cancer, diabetes, mental disorders, lung disorders are things which can actually be treated very easily. And this is the study that was done which showed that homeopathy works. This is a case of high cholesterol. And you can see over here how the cholesterol dropped from 232 to 196. So one thing that I want to mention over here is that all homeopathic doctors who are medically trained actually make use of all diagnostic tests and reports. So nothing is subjective, everything is objective. And the treatment can actually be measured, and you can actually see the results through all lab tests or all lab reports. And this was within 3.5 months of treatment. Similarly, diabetes, there are 60 lakh diabetics, which is 1.1500 per 100,000 diabetics in Thailand. So it's a big problem like how it is in India. India is soon going to become the diabetic capital of the world because of the number of diabetics that we have. And the average expenditure was 25,000 baht every year by an average patient. This is the research. One of the problems that you get in diabetes is it affects the eyes. So because of that, you get complications of the eyes, and sometimes it can give rise also to blindness. So this is a case which actually showed, the research which showed that there was 47% improvement in the blood flow to the eyes, and therefore blindness was actually prevented in such a patient and in these patients. Similarly, it was found that when homeopathy was used with allopathy, oral anti-diabetic medicine, the success rate was 82%. So it actually increased 27% by combination therapy. So again, this is really a misconception that homeopathy is alternative therapy. Homeopathy is complementary therapy. You can actually use it together with all the other medications that you're using, and it still works extremely well. So this is an HbA1c count. You can see of a patient 9.1 and coming down to 7.2, which is still not normal but controlled within 4 months of treatment. Again, high blood pressure. 25% of Thai people suffer from high blood pressure. High blood pressure is called the silent killer because very often they don't even know that they have high blood pressure. Sometimes you just come to know by a routine examination. You don't know that you have high blood pressure because sometimes you get symptoms like headaches, shortness of breath, nosebleeds, and sometimes you really don't know. And it costs 48% of outpatients and 34% of inpatient costs go towards treatment of this. And almost 13,000 bahts every year are spent on this. So this is the research which was again conducted internationally, which shows how homeopathy can help blood pressure patients. This was a case where the patient had a diastolic blood pressure of 105. So, you get the high reading, which is the systolic, and you get the diastolic, which is the low reading. The higher reading is not that important because that can fluctuate with anxiety, with stress, and if you're worked out or anything. But the low reading, if it's high, and if it's above 100, then it's something to be concerned about because that could give rise to a heart attack. There's something that you have to be careful about. So the diastolic or the low reading is what is very important, and you need to check that out. And you can see here that the patient actually came back to normal within 2 weeks of medication. And this is a testimonial from a patient himself who was 46 years old. Coming to arthritis, which is the other problem, as we are living longer, we are not necessarily living healthier. So we are now getting an aging population all over the world. And Thai people between the age 15 to 59, 40% of them, and 56% of them above 60 had mobility disabilities. So, you had septic arthritis as well, more common among women and also in the elderly. So again, look at the cost of it. Almost 300,000 to 600,000, 700,000 for a knee replacement. So can it be avoided in some cases? That's the question. And could you then use homeopathy, especially for rheumatoid arthritis and osteoarthritis? You can use it to help to treat, and research has shown that it works very well. This is a case of arthritis, and again, this is a testimonial from a patient which is put up on Google, saying that the pain and stiffness has now reduced and the patient has become mobile. I now come into the second last part, which is the mental health. As you know that there are lots of patients all over the world, and I've written a book on mental health recently and emotional health, that almost 17% of people suffer from depression, the cost of which is almost over $2 million US dollars. Suicidal ideation, not committing suicide, but the thought of committing suicide, is almost over 10%, and that costs $400 million US dollars. Stress 15%, anxiety 46%. So almost half of the people, including in Thailand, are actually suffering from anxiety. And what is interesting is that loneliness is 48% among married people and 47% among single people, which brings me to the point that married people are more lonely than single people. So here, cheers for all the single people in the audience, right? Thank you. So we all raise our hands. We all happier, 1% happier than married people. And the cost of that is $1,500 US dollars per person. So research shows that 17% of the population in Thailand is depression. The treatment cost, which is treatment-resistant depression, is 276,000 bahts per person. So this is really a lot of money that is being spent. And this is again research which shows how within 6 months, mood disorders can be treated with homeopathic medicine. So sometimes the earlier symptoms of depression are loneliness, not wanting to go to work, not wanting to meet anybody, not feeling happy day-to-day things, and just not getting involved. And some of them are mood changes. So suddenly you start, like bipolar, not to the extreme, but you suddenly start feeling very happy at small things and you start feeling very sad as well at minor things. So this is how you should recognize that you're probably likely to suffer from some kind of depression or anxiety. So this is a case, again, was almost suicidal and, became all right again with homeopathic medicine within 2 months of treatment. I now come to the last part of my presentation, which is rare disorders. That's my homeopathy is my passion, and I can talk about it till breakfast tomorrow morning. But I'm sure that you all want to have lunch as well and hear the other speakers. So I will restrict myself only to a few rare disorders, not all of them, that can be treated through homeopathy. So that just 1% of the population actually suffers from this, actually 0.5% suffers from rare disorders. But almost 5 to 8% of Thai population suffer from it, and the cost is very huge, $90,000 US dollars every year. I'm now talking about one case of GB syndrome, Guillain-Barré syndrome. It's not a very common disorder. When I was in Peru like a few months ago, there was an epidemic of GB syndrome, and the government has advised that people should not eat food outside because this is a virus that comes from food. What it does is it can actually paralyze you. It can cause paralysis, and so it's very rare, not very easy, but very difficult then to treat. So this is a case of ours who suffered in Bangalore, a 17-year-old child, a young man, and he was in ICU for 72 days. And ultimately, the doctor said, we give up. You just take the child home because there's nothing more that we can do. And this is the patient when he was in the hospital. And ultimately, today, the patient is actually, he's like this, and he's going to the gym. And we have a video of his father and himself as well, which he can play for you.
In 3 months of medications, we started seeing improvements in Dharan's condition. He was able to do his daily activities, and in 6 months, he started writing and walking, independent doing his daily routine.
And there are a lot of improvements also. I can walk distance more than before, and I'm not at all tired like before, and I'm making also. It is so good, and thank you so much.
So can you imagine the same patient was in ICU for 72 days? And this is how the patient is now. So these are actually the miracles of homeopathy and alternative medicine. And therefore, I urge all of you to at least try it. This is a case of alopecia totalis when there was no hair at all. It's an autoimmune disorder. And you can see with the treatment, within a few months' time, lots of money is lost in this as well. After 20 months of treatment, this is how the patient has the hair back again. So, again, this is another very rare disorder, called dentogenesis. Can we just go back? What's happened? Yeah. So this was GB syndrome, and yeah, and we've done totalis, and now we come to the last disease which I want to show you as a sample, which is a dentogenesis imperfecta. So what happens here is that there's a genetic problem, and the teeth keep falling off as soon as they form. And you can see here that this is what the child was when the child came to us, and this is what the child is now. So there's nothing better than a happy smile of a happy patient, and all's well that ends well. This took about 22 months, almost 2 years of treatment, but ultimately today the child is very confident and is able to get out into the world with a smile on his face. So finally, I'd like to end by saying that homeopathy today is legally practiced in 176 countries of the world, with 500 million people following it, and it's already a $1.6 billion industry all over the world. By using homeopathy, Thailand can keep their population healthy and save billions of dollars being spent on AMR, NCDs, allergies, mental health issues, and rare disorders. And therefore, the world has opened up to the benefits of homeopathy. When will Thailand open up to this safe and holistic form of treatment? Thank you very much. Kapunka.
ขอบคุณมากค่ะ Thank you very much. So could you please remain on the stage? We're gonna give you souvenir for thank you. เอาละค่ะช่วงนี้เรามีช่วง Q&A นะคะเรียนเชิญได้เลยค่ะ
ค่ะก็ขอบคุณดร. Mukesh Betra นะคะท่านผู้ฟังคงจะทราบว่าท่านมูเคชเนี่ยทำการบ้านมาอย่างดีนะคะแทบจะเปิดโฮมิโอพาธีประเทศไทยให้เราดูเลยนะคะท่านไหนมีคำถามบ้างไหมคะถามเป็นภาษาไทยก็ได้ค่ะเดี๋ยวจะแปลให้ค่ะถามไหมคะ
So no questions means everybody's understood everything or understood nothing at all.
ท่านไม่ค่ะ
Doctor? Thank you.
No questions ค่ะ
Can the homeopathy apply to the children patients? Use in the children.
Oh yes, it's very, very good for pediatrics, and almost anything that you can think of right from the time, including even for easy birth. For example, there are medicines like coliform, which actually promote easy birth in women from the time they are pregnant, and after delivery again from the time a child is born, including psychological problems like breath holding spasms. You know, that's very common today. When the child wants to revolt against the parents, they stop breathing and then they turn blue, and it's a very serious problem. Similarly, childhood asthmas are very common. So these are all things which can be very easily treated through homeopathy. One of the things I mentioned was atopic dermatitis. Atopic dermatitis is very difficult to treat. Normally patients are given steroids in allopathy. But in homeopathy with natural medication, again, without steroids, atopic dermatitis gets treated. So there are lots of such problems, including behavioral problems in children. You know, lots of children are very stubborn today. Today you don't give them an iPhone and they will throw their head and bang their head on the floor and start crying. So also behavioral issues in children can actually be treated through homeopathy. And we also have quite a lot of patients of autism as well. I'm saying, you know, there are so many, I would say almost at every part of, unless it's congenital and there's something which is, you know, like a valvular disorder, for example, where they may need a surgery. But otherwise, for almost all the other pediatric problems, homeopathy is very, very good. And, you know, because it is safe and it has no side effects, and, you know, patients call us candy doctors because it's sweet. So it's very easy. They like to come to homeopaths to get treatment. It's a happy place for children to come. Thank you very much for the question.
Thank you. I think we have another questions. 2 more questions.
What do you think about the pandemic? Do you have idea about the homeoprophylaxis? Would you please help answer? ป้องกันการใช้โฮมิโอป้องกันโรคระบาด
So good question. Thank you very much. You know, when there was a flu, which is, I'm talking about, you know, the Asiatic flu and, you know, the world flu, and the last big pandemic that we had was in 1917. And at that time, it was a pre-antibiotic era. So what really worked was that while 30% of people died on conventional medicine, only 3% of people expired because those who were on homeopathy. So from that time onwards, homeopathy is extremely good in preventive medicine. Unfortunately, lots of the governments are not following it, and lots of more people should actually use it. I'm coming back to the last pandemic of COVID. We distributed 1 crore, 100 million kind of medicines free to the entire Maharashtra police force and their families, because the government did research and they said a homeopathic medicine called arsenic alb, if you take it regularly, it will prevent you from getting COVID. So it was used nationally all over the country as a prevention for COVID. And there was a lot of research done by the Gujarat government particularly, which actually showed how effective it was. Similarly, I just want to mention there's something called Japanese encephalitis. It's a brain fever in children, and they get high fever and then they get convulsions. So again, the treatment was, allopathy with drugs and, things like that. But Andhra Pradesh government, one of the states in India, did a research by using only belladonna, simple homeopathic medicine. And when they used it, they found that not a single child in their state developed Japanese encephalitis or viral brain fever. So this is the importance of homeopathy. I'm saying, Hahnemann, who founded homeopathy, wrote in his Organon that homeopathy can be used very, very easily as preventive medicine. So yes, it should be more used. Thank you very much.
I think we have a question over there also.
Well, thank you very much, Dr. Mukesh Betra, and thank you for your research on the situation of homeopathy in Thailand. It's also the first time that I knew a lot about situation of homeopathy in Thailand. Anyway, I would like to ask you that since there are many patients who suffer from hormone unbalance, especially women after menopause, men after their retirement, etc. So currently, hormone therapy or hormone replacement is a quite important issue for this. Can we apply homeopathy for these hormonal disorders?
So very good question, doctor, and thank you for asking it. I would like to divide this into two parts. We treat in my clinics, we treat about almost 100,000 patients every month, out of which 45,000 are hair loss patients. Now, you'll be surprised to find that when you talk about hormonal imbalance in young girls, that's why I'm saying I'm taking your question into two parts, young and older. So in young girls, you'll find that when they are losing hair and they have a little acne on the face and they have a little hair on the chin, we diagnose that they are suffering from PCOD. So PCOD, polycystic ovarian disorders and ovarian cysts has now become so common in young people, and that's a hormonal disorder. And we are able to actually treat it through homeopathy, non-hormonal medication, totally natural and safe. And then the cyst dissolves in about 6 months to 9 months' time, and the hormones come back to normal. So that's an example I'm giving you of young people. Similarly, in the olden age, you get menopausal symptoms. So you get hot flushing, you get sweating and things like that. Homeopathy, again, is extremely good. We have simple medicines like lachesis, which are extremely good for patients who suffer from hormonal without using HRT. So HRT is also good in some cases, but it has its own side effects. So if you are able to treat women who are of the older age group with homeopathy and no HRT, no hormonal medication, it works very well. I hope I've answered your question. Thank you.
Thank you very much, Dr. Betra, that your session is an eye-opener over here. I know many of Thai people, they don't know about homeopathy. Maybe they know, maybe it's a less awareness over here. As you said that we have only 76 doctors over here. They are not highlighted much on this one. Second thing, medicine is not available in Thailand, easily available, which I have to request our Thai government to allow them to bring the medicine, and more doctors should be, highlighted on this one. Personally, yes, I have taken the medicine from homeopathy when I was in India, but not over here. But if I see any doctors over here, definitely I'll go and get treated there, because I'm a heart patient myself. So I would like to know about how the heart patients can be cured on this one. Like I had a heart attack, I had a bypass too. So homeopathy can help or not? Thank you very much.
Thank you very much. So really you got to take discipline all your life, because it's a blood thinner, because you don't want any clot to happen again. And normally also this happens because of thickness of the arteriosclerosis. which means there's a cholesterol deposit in the arteries, and because of that it happens. Now, that is where homeopathy can help. And I gave you one case of high cholesterol. But otherwise, I think, you're safer with allopathy because of your CABG that you've done, because you want to make sure you don't get another heart attack again. And that's really my honest answer to you. But if you've got high cholesterol or high blood pressure as a kind of a comorbid, as we call it, symptom, together with your problem, in that homeopathy can help you very much.
Since we still have about 7 minutes left, so let I ask you one more question. Currently, the topic of cellular health, cellular health, cell health, health of cell, there are the mechanism of cell degenerations has been clearly described now, that what do we mean by cellular, degeneration, and how it leads to many diseases, especially diseases that you just explained, atopic dermatitis, NCD, and many other unexplainable diseases which are not caused by virus, is not caused by any pathogens, but it caused by, this cellular degeneration. But I listened from your lecture. I believe that homeopathy must have a lot of things to do about cellular health. Can you explain a little bit about how homeopathy lead to cellular rejuvenation, or how it improves cellular health?
Well, thank you very much. There's very little that I can offer in terms of research in this on this topic, because it still needs to be done. A few years ago, we started something called genetics in homeopathy, and we actually sent samples to LA, wherein we could actually do the genome study and then see the impact of homeopathic medicines on that. So to that extent we did it, but after COVID, unfortunately, the lab shut down, and so right now we're not doing it any longer. But we carried out that research for about 2 years or so, and I would just think that it's still inconclusive for me to actually say that there's direct conclusive evidence whether homeopathy can actually help cellular regeneration or not. I cannot answer your question honestly, because there's not enough research being done. But I'm sure my colleague Mickey Mehta is going to talk about it, because there's a lot that yoga and natural medicine and holistic medicine can also offer against aging, because that is his topic next. So I leave it to him to answer it and take it from there.
I have one question.
Yeah, sure.
In homeopathic, like normally when we first visit the doctor, they ask the complete history, like from childhood. So what is the reason, like because the medicine, how it is correlated? And the second question is related to the depression. In allopathic, they control the symptoms, they don't cure. Does in homeopathic, is it cured or it's still the same thing, it controls? And what is the time duration of it?
So your
Thank you.
sorry. What is the first question? Ask her. Okay, thank you very much.
Do you want me to repeat
No,
the
I
question?
got it. So why do we ask so many questions in homeopathy when you come first time, and actually every time? So actually homeopathy is holistic medicine. So it's very important to understand that there are lots of problems which come up today, which are physical manifestation of something which can happen in the past, including your childhood. And we have medicines, because it's holistic medicine, because it's mind and body together. So when patients are actually proving homeopathic medicines, what is happening is they actually are told, they actually give you symptoms. Like for example, if I'm taking a medicine, I'm not saying I've got a headache, but I'm saying I've got a throbbing headache. I'm now saying that I feel depressed. I don't feel like moving out. So it's very easy to match the drug symptoms to the disease symptoms. So which is why it's very important to find the right drug. You need to get as many symptoms as you can, including emotional symptoms. I hope I've answered that question well, but I'll give you one example. So for example, there was a patient of mine who had a severe backache for many, many years, and he was working in a multinational bank. Banks got nationalized a few years ago in India, as you know, and so he had to look for another job. And he then went for an interview, and one of his juniors were interviewing him. And he then said that, how can he dare interview me? I was his boss. And can you imagine, he's questioning me now. So on the basis of that, there's a homeopathic medicine which is called staphysagria, which actually has problems coming from remorse and from, thinking about the past. So because of that, what happened 10 years ago, his backache was persistent. So that is why it's very important to give all these symptoms, because you can get the right remedy then. So the more you share with the homeopath, the more likely there is that you'll get the right remedy. For any one patient, there are 98,000 permutations and combinations that I mentioned. So you need a trained doctor to actually get the right one for you. Answer to the second question very briefly. Depression, yes, it can be treated. It's relative. I always say there's just that 1 second of madness that is the difference between depression and suicide. It's something that you can't take a chance with. You don't want to leave such people alone. Very often I've seen patients not even wanting to be treated with depression. So I've had many patients coming to me taking medicine, but they tell me that don't tell my child that you're treating for depression. Say that you're treating for loss of appetite or something else, because they don't accept that they're suffering from depression and they don't want to take treatment. And if you tell them that, they'll just throw it out. So acceptance of treatment is very important. And once you accept it and when you take regular treatment, yes, with homeopathy, depression can get cured.
Hello. So basically, Dr. Mukesh Betra, I think lots of audience here would like me to sort of summarize in Thai for them because they're very curious about all the things and they might miss, some information. So let me just briefly. So เดี๋ยวจะขอสรุปสั้นๆเป็นภาษาไทยนะคะพอดีทางผู้ฟังสัมมนาคอมาก็คือท่านดร. Mukesh Betra ค่ะก็ได้กล่าวนำเกี่ยวกับว่าโฮมิโอพาธีเนี่ยค่ะเกิดขึ้นที่ประเทศเยอรมันนะคะโดย Professor ซามุยนะคะซึ่งโฮมิโอพาธีเนี่ยค่ะเป็นศาสตร์ที่เขาเรียกว่าสิ่งที่ทำให้เกิดโรคจะเป็นการรักษาโรคนั้นนะคะเช่นท่านก็ได้เล่าเรื่องการใช้หอมใหญ่นะคะคือหอมใหญ่ในเวลาเราผ่าออกมาเนี่ยน้ำหูน้ำตาจะไหลใช่ไหมคะโดยเฉพาะคนที่เข้าครัวบ่อยๆโฮมิโอพาธีนี่คือเขาจะบอกว่าสิ่งที่ทำให้เกิดโรคก็คือสิ่งที่รักษาโรคนั้นเพราะฉะนั้นเวลาเรามีอาการเป็นหวัดนะคะตอนที่เป็นช่วงโควิดจะทราบว่าเวลาเราเป็นหวัดก็มีคนบอกว่าให้เอาหอมใหญ่ต้มน้ำแล้วก็สูดเข้าไปก็คือหรืออีกทีนึงก็คืองูเวลาเราเจองูกัดนะคะพิษงูก็คือรักษาคนที่ถูกงูกัดมันก็คือเป็นศาสตร์ประมาณนี้นะคะสำหรับโฮมิโอพาธีสิ่งที่ดีสำหรับโฮมิโอพาธีนี่ก็คือยาเขาจะไม่มีวันหมดอายุนะคะเพราะว่าใช้เป็นสมุนไพรนะคะแล้วก็บวกกับพลังงานเข้าไปแล้วก็ไม่มี side effects นะคะ เพราะฉะนั้นเนี่ยยาโฮมิโอพาธีเนี่ยค่ะสามารถใช้ร่วมกับแพทย์แผนปัจจุบันได้เลยนะคะแล้วก็ท่านก็ได้อธิบายว่าการใช้ยาโฮมิโอพาธีเนี่ยรักษาโรคอะไรได้บ้างที่คนไทยเป็นบ่อยๆนะคะอันแรกนี้ที่ท่านพยายามย้ำก็คือการใช้ยาแก้อักเสบของคนไทยนะคะคือคนไทยเนี่ยหลายคนเนี่ยพอเราเป็นโรคนิดๆหน่อยๆไม่ได้เป็นโรคอะไรร้ายแรงก็จะไปโรงพยาบาลแล้วก็เหมือนพยายามแบบว่าอยากจะได้ยามาเพราะว่าจะต้องไปทำงานในวันนั้นเลยนะคะประมาณนั้นท่านก็เลยบอกว่ามันก็เลยเหมือนการเป็น pressure ให้หมอเนี่ยก็จะต้องแบบว่าสั่งยาให้คุณกินแล้วก็ส่วนใหญ่ก็จะต้องเป็นยาแก้อักเสบเพราะฉะนั้นเนี่ยอาการอะไรที่มันเป็นโรคเล็กๆน้อยๆเนี่ยคนไทยก็กินยาแก้อักเสบแล้วก็เดี๋ยวนี้ Google เนี่ยก็ค่อนข้างง่ายหลายคนเนี่ยก็เชื่อ Google เนาะดร. Google มากกว่าคุณหมอที่โรงพยาบาลท่านก็เลยบอกว่าหลายคนเป็นโรคอะไรก็ถาม Google บอกให้ไปกินยาแก้อักเสบก็ไปทานยาแก้อักเสบแต่ยาแก้อักเสบเนี่ยค่ะมันมี side effect ถ้าคุณทานเยอะเนี่ยเวลาที่คุณเป็นโรคจริงๆเนี่ยที่มันจะต้องใช้ยาตัวนี้ค่ะมันจะเกิด side effect ก็คือมันจะการทำให้คุณไม่สามารถยาตัวนั้นเนี่ยจะไม่สามารถรักษาได้เพราะว่ามันเหมือนกับว่าร่างกายเนี่ยมันไม่มีประสิทธิภาพต่อยานั้นแล้วท่านก็เลยบอกว่าโฮมิโอพาธีนี่ก็จะช่วยได้เพราะว่าเราจะพยายามลดการใช้ยาแก้อักเสบสำหรับโรคที่มันเป็นโรคง่ายๆนะคะแล้วท่านก็พูดถึงเรื่องการแพ้ต่างๆคนไทยจะแพ้อากาศแพ้นมเยอะซึ่งโฮมิโอพาธีเนี่ยมันก็เป็นเหมือนคล้ายๆยาสมุนไพรที่มีพลังงานเข้าไปนะคะก็จะสามารถช่วยคนไทยได้ด้วยเหมือนกันแล้วก็ท่านก็ได้กล่าวถึงโรคที่เป็น rare disease ด้วยนะคะที่เป็นโรคที่พบยากอันนี้ก็สามารถช่วยได้แล้วก็มีอีกโรคอีกหลายๆอันที่คนไทยเป็นนะคะก็นี้ก็จะใช้ยาโฮมิโอพาธีซึ่งจะเป็นการช่วยเสริมกับยาแพทย์แผนปัจจุบันได้ด้วยค่ะนี่ก็เป็นสรุปสั้นๆนะคะ